All right, good morning. This is Senate Health and Welfare. It is April 10th, and this morning we're taking a look at for the budget areas for which we're responsible. We've got joint fiscal here to help us go through what is currently in the budget and maybe some of the asks that are in the budget that haven't been funded, some of them that have been funded. And then tomorrow is it's a bigger day when we look at all the folks who would like to request of us their support. I'm going to turn it over to the two of you. Do you know everyone around the table?
I don't know. I know Senator Cummings.
Yeah, I know me. So I think
Senator Hart from Orange County.
Yeah.
I'm Senator Small Town.
okay, so good. So go right ahead and we'll look at our spreadsheets and listen.
Great. So I'll just I'm Emily Byrne. I'm a deputy fiscal officer for the Joint Fiscal Office. I spend most of my time with the appropriations committees, helping work on the budget. And Nolan, who you all know, I'm here as like support. No one's gonna help.
She's my reinforcement.
And you are our support.
I'm gonna turn it over to Nolan.
For the record, Noel Langwell, the Joint Fiscal Office. What we're going to share today is a snapshot of a sheet that has been used in the Appropriations Committee that just sort of shows the difference in some of the governor's proposals, what the House did, the difference of them is. Some of these we can go into detail about because I know about them. Some of them I don't know what they are, and I can't provide the detail. And I would recommend if you want more information that you have the department, the agency, the advocate, whoever. So to the best of our knowledge of what we know what it is, I will explain it to you. But if I don't, defer. So let me share my screen. This is on the website. And it's two pages. So the first page is our base fund appropriations, and the second page is one time. So the first thing you'll notice on all these are all. So this, I'm not to go into it with how the budget is laid out in your A section, B section, C section, but the B sections, what you need to remember is the 300s, and every one of the 300s are agency of human services. And then the Green Mountain Care Board, and you have some other small things, but usually that's where you find all the health and human services related things. The large version of this sheet, which Emily has over here, is like every section 100 through 500 or 600. I forget. 900. We're just going to do the 300s because that's the area of your jurisdiction. So I'm going to walk you through the sheet. Like I said, to the best of my knowledge, I can explain each of these. Most of them I can, some of them I can't. But this is really more to highlight like what's in the budget, what are the ups and downs. Now, the other thing I want to point out is that if it's a dash, the changes are always changed from base. So on the left side, if you see the governor, for instance, the first slide, you see the governor added $29 million. That's off of the current base line. So he's proposing additional, $29 million for, we'll say the GC match. The House, as you see, concurred. And so there's zero difference from the governor. Whereas the next one, without going into detail at the moment, you can see the governor didn't do anything. But the House proposed adding $4 million. Just to give you a sense, and then the far right shows you that's different from the governor recommendation. This is just to help situate you so you understand how to read this particular sheet. It's kind of like what we call the ups and downs. This isn't the ups and downs, but it's in the similar format of up or down from base.
Base meaning the FY 2025 as passed budget.
Yeah.
Is the starting point for building a budget.
And then the second page is one time. So those are not base. Those are just with revenue, there's extra money in the budget to be able to pay for things that will be just for this year alone.
Okay, so where it gets zeroed out doesn't mean there's no money. It just means there's no additional money from last year.
Correct. If we were to tell you where the money is for everything, we would be here for weeks. That's what the Appropriations Committee does. They talk about here's what's in the budget, here's what's in the base. They go in detail about what their base budgets are, what's in them. We're talking about the changes. And so with your committee, I think what the vision I assume is here is to get a sense of what were the new proposals the governor proposed? What did the House do in terms of doing it or not doing it? And then the final thing of what do you want to do? What are you going to recommend to the appropriations committee? And you may recommend things that aren't on here, and that's your priorities. And that'll show up as, and when it goes onto this sheet, it'll be a dash in the gov, a dash in the House, an add in the Senate. So with that context, I will start. So the first thing is, I will tell you what the acronym is in the beginning. So AHS-COO stands for Agency of Human Services Central Office. And this first thing, Global Commitment Match. This is what everyone calls the mixing bowl. So throughout the ups and downs of the new additions, a lot of them are global commitment matched. And so as a result, this is where it gets matched. Not to go into detail of how global commitment works, but it'll show up in the other departments often as gross, or these are all general fund.
This is just the general.
This is just the general fund share. But then that's where it gets matched with the federal dollars. So if you change it's up below, then that the global commitment match would change to the extent that it's global commitment matchable.
And for this first one, this $29 million seems like a big number. The majority of that number is really just the changes in caseload and utilization that are projected in the Medicaid program from FY25 to FY26. So it's really, there's a consensus process between the Joint Fiscal Office and the administration to determine, like, you know, it looks like Medicaid trends are showing there's more kids in the program. There's fewer, you know, people in this category. It looks like services are growing here, and sort of we go through all of that and try to project what Medicaid spending will be in the future. And so that $29 million is really just a reflection of what we think increased caseload and utilization. And then this year, it's mostly increased utilization will be in the Medicaid program in FY26.
So the next one is the federal, it says match, so that's the general fund share for the FQHC rate increase. So the House, the governor did not propose any changes for FQHCs. The House heard testimony from by state that they wanted a rate increase, and so the House gave them a it's $10.7 million increase, and that's 4.42 in general fund. The next one also.
I jump in on this one real quick? So one thing on this one that we've heard from the Agency of Human Services, and might be something for this committee to explore, is whether or not this needs to apply to both FQHCs and RHCs, the rural health centers. And my understanding, and I think this is a good thing for the committee to find out, is that it has to apply to both. It can't just apply to one. And we've heard sort of conflicting information. So that's a thing that should be clarified, and then the Senate can figure that out.
But I think that this number actually includes the rural health centers.
I think
it does.
So it's just, which should say match for FQHC and rural health, RHCs.
Yeah.
RH. Thank you for the clarification. The next one is rate increase for family planning E&M code. So E&M stands for evaluation and management. This is, as you know, hospitals use, or providers use different codes for the specific services that they provide. So this would be a rate increase specific to this family planning E&M code. This was an ask from Planned Parenthood. It gets a 90-10 match. So it's 0.09, but it's $85,000 because it's rounded. And that would draw a total of $850,000 global commitment. So the House decided to do that. The next one is home and community-based service rate study. So this was, there was a study in 2023 done by Dale that looked at a lot of the choices for care, home and community-based services. And it was to show how much money would be needed to bring those rates for those particular providers up to the 2023 levels, or 2024, I can't remember. And so they decided to fund that particular piece. That's the ones that are in there are ERC, which stands for residential. ERC stands for enhanced residential care. And then there were some other choices for care providers that were in there as well. So those are the folks that are getting that. I don't know what that represents in terms of a percentage rate increase. This came from the Human Services Committee, and this is how much money would be needed to bring them up to that level.
All right,
So-
which one are you talking about?
Talking about the home, the
Community providers rate increase?
The one above.
The one above it.
Oh,
That
the one
would
above it.
be-
Yeah, I don't know what percentage that is either.
Yeah, I don't know. So, but its gross is up to about $6.8 million. It's $2.8 million in general fund. The next one, the community rate providers, is a 2% increase for specific, well, it's most of the home and community-based providers, but not all of them. So this is where it gets a little confusing. There is a little overlap between the folks who are going to get the rate study and the 2%. But mostly this was a group of non-home health agencies, I think. No, I remember who got this.
I think we'll probably be dealing with that down in appropriation, but I think they left out adult day.
No, adult day's in there. It's just
Is
that
it?
the question
Sure.
is whether it captures all adult day. The way we have it in the budget
Yeah.
is that it goes through sections of the budget. So this actually is in multiple sections. You can see it's the P301, 314, 330. That's because we have agencies that provide this here. For instance, DAs and SSAs. They provide services through the Department of Mental Health. They have stuff through DEVA. They have stuff through Dale. So they go across multiple parts of the budget. So in the budget and the ups and downs, when you're going through it down the hall, you're going to see a rate increase in the one section. Now the rate increase, this goes across multiple sections, but this is the total rate increase across all those. And it does include, right here actually, ACCS, which is Assisted Community Care Services. It has issue providers, substance use disorder. We have DAs, SSAs, adult day, AAAs, SLPs, which stand for shared living provider, TBI, which stands for traumatic brain injury, personal care services, homemaker, respite, etc. So those are the different providers. Actually, the last one, I think, is the other one. Anyway, those are the providers that are covered. I know I've spoken with Jill Olson. I know she had some concerns that there were some groups that may be left out.
That was what I read last night or this morning, and I think she thought adult day was out, so
Adult day is in. The question
Yes,
is whether all the adult days are
not
in.
all of them.
And I would recommend if there's somebody left out, I recommend that if you talk to Jill or other advocates to help understand that. But this is
We are not going to talk with anyone. We're
Okay.
listening to
Great.
what's been presented to us tomorrow morning.
got it.
That,
Okay, thank you. Now the next one you have is the 211 increase. This is total global commitment of 332,000. It's $140,000. General fund. I actually don't. Do you know what 211?
that makes it 24/7.
Thank you. So the next one was the governor recommended these recovery campus. It was 1.5 million total gross. It was $620,000 in global commitment. The House felt that they didn't have enough information. They felt that the agency did not provide them with enough detail to understand what it was. And it didn't meet their priorities. So they chose to take it out. That's why you see it's negative, why you see there's nothing in the House and then negative 6.62, which that just shows that's the difference from the governor's record.
So there's actually a total of 1.5 for all of this. Some of it's base and some of it's one time.
No, with 1.5 is the total
That's
Gross.
total.
state federal.
There is one-time money as well.
There is one, oh, that 300,000. Okay. Okay, but
But it would have, it's global commitment matchable, so it would have drawn in federal fund.
I did ask for language on this, and I'm going to take that language into appropriations for the discussion. I think this committee has always been supportive of having expanded services. We did X36, and we understand the need for some mid-level recovery residences. So we'll take that. We'll look at that.
I'm going to skip this next one and go to aftercare navigators only because that is tied. My understanding is that's tied to the recovery campus.
Yeah.
So I believe that it's a separate line item, but it's tied to that total initiative. And that's why that one was taken out as well. And then the right above it, the re-engagement beds, withdrawal management. They just matched the governor's recommendation on that. Next, we have DMH, the Department of Mental Health, an alternative to emergency beds. Again, the House concurred with the governor's recommendation for $360,000 for that. The next one is the Howard Center community. Next two actually are Howard Center. The community center outreach, and then the embedded clinicians first call. So the governor had reduced spending for this by 160, I think a total of 420,000 or 30,000 for the two of them. And you can see that the House put it back. That's why it's dashed. So the dash means that the House actually put that back in. So it's not an increase from base. It's just getting rid of the elimination of it. So the House chose to add back the reduction for that. And then for the embedded clinicians, they added some of it back. They added back 250,000. So it's a $20,000 reduction versus the total $270,000 reduction from the governor. So they added back again. They added back the Howard Center, and they added back most of first call, not all of it. The next two are CCFAP, and this is tied to, it gets complicated, and Emily jumped in to help me explain it if needed. But basically, there's a sense that the caseload, so we built projections of what we thought the CCFAP, this is the child care program that we passed 2 years ago now, and we made estimates on how many kids we thought would be in the system and what the spending would be. And tied to that is payroll tax. So what happens is that in the projections are consensus. It's based on, at the time was based on not having experience of what actually happened or what's happening on the ground. So last year, I think the utilization was off even more than it is this year. We're still trying to dial it. It'll take about 5 years for us to really kind of figure out what that kind of utilization is going to be. So you have a caseload savings of $3.5 million, which means the caseload is a little bit less than what we thought it could be. And there's multiple reasons, but I won't get into that. But we concur, JFO concurs with those estimates, or believe that they're reasonable. We have no issues with that. So what they've done, the next one is we have it as a fund shift. So basically, as a result, there was extra money from the payroll tax. And by the way, we always knew that the timing of the payroll tax would be different than the timing of the rollout of the programs. So we always knew in the beginning there would be excess payroll tax because of the timing of when you put a payroll tax in and how it comes in versus the expenditure. There will be a point where it does this, or at least hopefully does this. But right now it's doing this. And so what the administration proposed was, since there was extra payroll tax, use the payroll tax to pay for the program, bring up general fund, because right now CCFAP is a mix of payroll tax and general fund. So they backbilled the general fund with the payroll tax to pay to free up general fund to do other initiatives within the program.
And I think the payroll tax can only be used for childcare. So to the extent the state is collecting those dollars and they're sitting in that special fund, the proposal, and the House accepted most of it, was to utilize those dollars that are being collected, rather than have them just sort of sit in the special funds, put them to work. So the $19 million was the administration's proposal in terms of, and the payroll tax number is adopted by the emergency board as part of the consensus revenue forecast. So it's consensus revenue number for that piece. And the change that the House made, they decided that to invest some dollars into infant and toddler rates, so to increase them by 4.5%. So that means we have to put a little bit more general fund back into the program. So they propose to take 19 million out. We're not going to take, or to shift the full 19 million. We're not going to shift the full 19. They need another this number actually is off a little bit. If the Senate agrees with the House's proposal, we'll have to increase the number slightly to about $5.1 million. But that's the sort of, there's a couple things going on in that line item.
I'm assuming this is the source of the rash reform letters I've been getting over the last 24 hours, stopping the governor's systemic defunding of childcare.
Right.
I can't think
So,
of
yeah,
what else it would be.
The advocates would like to see the money go into a special fund and be used and sit there and be, not, I wouldn't use that term, but be used in the future.
Yeah.
For needs or rate increases or specific to the child care program.
it's not just the advocates. I think that there's some strong sentiment
Sure.
on the part of the
Yeah.
Appropriations Committee members that the child care fund not be rated on a regular basis.
Nevertheless,
But this would be a one-time event.
been doing it.
Yeah.
Well, and I think, it's important to what's happening with this.
Right.
Like the program is still fully funded. So the
Yes, we got it.
resources needed to fund the program that exists in statute today is funded with what the house's budget.
One of the compromises that happened in the House, though, is rather than create a special fund, new special fund to put this into, they changed the language around the caseload reserve to be able to be used for childcare as well. That was sort of the compromise they found at the time because there was still a need for within their initiatives to find general fund. So, but there was no new special fund created specifically as a reserve. Or there's no reserve created for CCF. The next is OEO. I don't remember Office of Economic Opportunity. This is the HOP grants. So this is there's some overlap with H91. This goes
Yeah.
towards housing and shelter and temporary housing. The governor proposed an increase of 3.35. The House concurred. Conflict-free case management. Again, governor proposed 1.29 at the gross, that's 640,000 in general funds, and the House concurred. Same with pathways for partnership. The House concurred with the GovRec. Vermont, the VBA stands for Vermont's veteran home, and there's a rebase in the budget of 5.71. Again, House concurred with the governor recommendation. The last one.
On that one, but the veterans home has had to have some pretty significant budget adjustments in the last couple of years. The hope is that by making this adjustment and putting this money into the veterans home, that they won't need that budget adjustment going forward, that this will sort of reset them to a more sustainable level.
When you're talking about budget adjustments, are you referring to infrastructure costs? We've been discussing about a lot of institutions from the veterans.
No, they just need a budget adjustment for their
For
operating.
operating costs, okay. Right.
The last one on this page is the expansion for AHEAD. This is basically the Green Mountain Care Board had saying that they need 5 physicians in order to implement the AHEAD model. And in the budget, the governor proposed 3 physicians. So you have more physicians in your S126. But that's what this is. 300,000 would be for 3 physicians for the Green Mountain Care Board to implement the AHEAD model.
Yeah.
Right, so.
So, and just FYI, there's been a lot of conversation in appropriations on many of these things here. So if you have a specific interest, you should bring those up tomorrow. But I think, a lot of the conversation will continue down the hall on these as it came to us.
And the last thing on this page, sorry, because I haven't scrolled down all the way. They left money in the budget. So the H91, which is in this committee now, the emergency temporary housing, emergency temporary shelter bill, passed after the budget, but they left $10 million on the bottom line to fund the one-time appropriation that's in H91. And that's the money that's going to go, that's in the budget to go to CAPS. And I know that this committee will discuss what that appropriation should be within our bill, but the House left 10 million on the bottom line to fund this bill.
And we heard yesterday from the CAPS that it might be 6.5. So we don't know.
Okay. So now we're going to move into one time. And all the one times are in what's called the E1100s. And then the E or the F, that's just how they're numbered in that section. But this is all where all the one time funds are.
So, and the base funding is important, but it's also a balance of moving things around to keep the base budget neutral as much as possible. Now, I think most of our interest is here on the one-time page
Yeah.
in this one. Okay,
So, first one is, so the governor's recommendation had $10.8 million for Blueprint and SASH, and this is basically to backfill the loss of Medicare's participation. So when the all-payer model ended, under the all-payer model, as part of the agreement, we were the federal government Medicare was contributing Blueprint payments to primary care practices. And so at the end of the all-payer model and beginning of AHEAD, assuming that whatever AHEAD agreement would allow for the continued payment of participation of Medicare. But in that gap, which is, I don't know how many months, if AHEAD even happens at this point, there's at least a year gap. And so they proposed backfilling the loss of Medicare participation with state dollars to kind of keep the flow moving to help those practices. Now, in this, it's one time, but I believe we're using global commitment investments. So we are getting federal match, but I don't believe that is the long-term plan. The plan obviously would be, now, if AHEAD doesn't happen, that becomes a conversation for next year. What do you want to do around Blueprint and SASH? But that's what this proposal is, and the House concurred with the governor's recommendation. So again, this is actually 10.8 billion. That's 4.45 general fund. Oh, this one shouldn't be here. Fire
I
apparatus.
know that was in the last one you gave us too, but we'll just look at it and say, isn't that interesting?
And then
With the,
yeah, I went through the one times and I tried to delete all of the non ones that would be here. This was a Nolan error. So
It's okay.
but it's a fun thing. We're gonna get a fire, there's a proposal to give FDR a fire apparatus.
yes, here's what the apparatus would look like. There's governor recommended $480,000 for PCB testing at the health department. And the House reduced that by 50%. Again, we have a pilot, this is a one-time cost associated with the pilot recovery. This is 500,000. Again, the House had eliminated the whole recovery campus setup. This was one-time start cost.
Oh, we went right over PCB, but that really, it is in the Department of Health, and there is a lot of discussion going on down the hall with education folks and others. So we'll put that one aside for us in here, but I know that it's important to folks in the room. Okay.
Right. Next, we have empty arms. I believe this is to help bereaved parents who lose newborns. They heard the House heard testimony, compelling testimony, and they had been asked for $40,000. So the House added this in. We have $300,000 for recovery residences. I will flag that there's also 300 or 350 or 600, I can't remember, in H281, which is the opioid bill, which is in this committee. So there may be some overlap between here and there. So just flagging that, I don't know.
I don't know whether the money for these are coming, if this money is coming from the settlement fund or not.
This is not, this is general fund. This is all general fund.
And I know there's been conversations about that.
Yeah, my point is that
Yeah,
it's in the bill, which is settlement fund in 281, and it's here, which is general fund. So it's in twice. Now, I can't tell you what the difference is on that in two different places, two different appropriations, the same thing.
good to know.
$2 million for shelter capacity expansion that the House concurred with the governor's recommendation. The next one is very much tied to H91. This is the 30.5 million for the GA emergency housing. So politics, I know there's been all the conversations around BAA. The governor's recommend is the current program. The current program that we have for 25 with the adverse weather conditions and the 80 days and 1,100 beds. that was in the current year and is current policy absent the executive order. The proposal was the same program for 26, and the House concurred with that, with the idea that they were going to be doing H91, which focuses on fiscal year 27. So the idea was, okay, they didn't touch it in the budget. They addressed it in H91, which is not focused. The only thing in 26 is the $10 million to help the CAPS move into the new program, which would start in 27. So this is the $30.5 million, and it's one time, because even though it's every year for the last couple of years, it's still considered one time and not base.
And I think, never mind. There, we get it.
The next one, so I keep looking out the window because my stepdaughter took her driver's license today. And I can see the car sitting over there.
Okay, wait.
And I just got a text that she passed, so.
Which car is it?
That's the first one, that gold one. Anyway, sorry.
Nice work.
So I've been kind of watching all day. Kind of funny to be sitting right here, I can see it. All right, the next one is Indiva, Department of Vermont Health Access. This is comprehensive payment reform. I actually do not remember what this is. Do you, Emily?
Yeah.
That Mike Fisher might.
Primary care. I think we're gonna hear about
Okay,
this tomorrow. We're good with it, I think.
Okay,
But it is important. And this is, it's just general fund match. No.
this is.
Yes.
Just general fund. It's a good question.
Well, we will have match.
It probably is matched, not
Yeah.
in this letter. I assume it would be. I don't have it on this sheet. My other sheets, it would tell
I
me.
have a sheet on it.
Okay. Then we have the one care primary care transition. This is to sort of help primary care practices as one care sort of winds down. I believe this is tied to Blueprint.
Well, Blueprint is up above.
No, but there was more.
There's a whole need
Oh,
because
yeah.
one care is going away.
Just payments
And we
from
have
one
to pay
care.
for the year 26 before a head comes into
Right.
place. So we're sort of doing the transition and covering the loss of funds from one care. So it's like a $10 million primary
Yeah.
care total.
Got it.
Yeah.
This last one is for home share. I don't know anything about home share, but the House funded $240,000, was not in the governor's direct.
Just a new program.
And then the last one is that there was H472, there was additional positions at the Secretary of State's office around Executive Office of Mental Health Professionals funded with fees in the future. So I think this is a new bill. And what happens often is that when you start a new program for the Secretary of State's office, there's new fees, but the fees don't come until later. And so this is to help them pay for the work they do in the first year, and then going in the future, the fees will actually cover the cost, but they don't get the fees right away. So they have to have some money up front to be able to do the work. We do this all the time with Secretary of State's office when we do things. We'll fund them and put general fund for the first year to get it off the ground, and then going forward, they're able to use the fees to pay for the state.
Did this bill go through GovOps? Has that bill gone through anything?
I
Here,
don't actually remember what bill this was. I don't believe I was.
H472.
No, I know that. I don't remember if I worked.
Oh, no,
I don't think I worked on this bill, so I
I
don't.
don't remember at all.
Yeah,
We'll find out.
I didn't work on this bill, so I don't remember.
Yeah. Okay,
He's similar to her,
Oh,
but he
okay.
doesn't know about the bill and he's on the answer. So
we'll find out.
Yeah.
It'll be come up.
And that's what we have on our sheet.
I have comments.
Oh, good.
You want to hear?
Yeah,
Okay.
but
Comments
okay,
slash
what,
question.
but so we're gonna save our, anyway, go ahead. I don't care.
Save our anger and ire for another time or
Yeah, no.
Well,
let
it's
it
not-
loose right
It's
now?
not on me.
Can y'all speak to why the PCV testing money was cut in half?
No.
Okay, well then I need to say that I completely oppose this. The PCV testing was a program put in place by the legislature. They had the opportunity to pause it multiple times and refused. it has been very deleterious to school districts to have to navigate the testing, which was not only problematic to the functioning of the school and the teaching of the children, but has cost a lot of money. So the money that is not paid, that is reduced in here, will be on the backs of the districts, which will be on the ed fund. And we're trying to do education transformation, and this is really problematic. And I'm sorry, I'm looking at you.
Yeah, really.
So I want to assuage her concerns that this is a conversation that Senator Ruth has also brought up in appropriations, and I think that we can talk further, but I think that you will be
Okay,
fine with the
Great.
final output.
we're gonna ask
Yeah.
schools to do things. We need to support them.
You got it.
Otherwise, we shouldn't do it.
And I think for context, at least, but some of the conversation in the House that I heard was that they had asked the administration for some additional information in terms of how many schools or what the money was gonna buy, and I don't think they ever got an answer.
Okay.
So I think part of this was also
Problem too.
what, it would be good to know, how many schools and how many tests, like all of that sort of detail was not, I think, presented to the satisfaction of the House Appropriations.
All right.
Why they changed the number. But-
Thank you. But I stand by what I said.
Well, this is an important message that I can convey when we're done.
Thank you, Senator. Thank you, Chair Lyons.
Okay, now excuse us for a minute. We need to take a break.
Yep.
No, it's all good.
Where is it?
Oh, the car. They're just standing outside the car. I bet she's taking pictures.
Should we all stand in line?
She won't,
It's really embarrassing.
no, she can't hear us. We can all go out there
We could all go
and
out.
sing to her. She'll love that. Sorry, I apologize. It's good news.
Watching family, real time.
Okay, so
Multitasking.
questions for our joint fiscal? Yes.
Well, I know it's for joint fiscal. I was told that I think it was Buildings and General Services had paused all the testing in face of doing education transformation because we weren't sure what buildings would be open. So I don't know. That's several steps down the line. And maybe they've restarted it. But my source is one of the companies that's doing the testing.
Oh, whoops.
So it might be worth checking out while
I
we're
think
doing
we've
money
gotten
to see if
beyond that.
anyone's actually
I think
doing
there
it.
is testing going on and there's certainly funding for it currently in the budget.
Yeah,
So the
that doesn't
question
mean
is
it's being
what
spent.
further, right? And that it's kind of not our jurisdiction, but it's our jurisdiction because we all have schools that have these problems. Oh, and it is a public health issue.
But it would just be nice
It would be nice
to
to
know
see it.
while we're appropriating money, if they're actually
You got it.
spending.
And I think that Senator Gulick would probably agree with you that this is. All right. Do you want to take pictures?
It's too far away, sorry. I pay attention.
Any other questions for Nolan, and Emily? So appreciate your going through it. So it's a lot. If you haven't heard this before, it is a lot. And there are a lot of things, moving parts right now in the big bill discussion down the hall. I think our goal tomorrow is to look at what are the one-time requests and how do they fit in with our priorities. So, that's where we'd be spending our time. And if you have something that you feel strongly about on the base funding piece, we can follow up with that. I know obviously GA program, H91, that's in here big time. We'll be looking at that together. And then we have S126, which relates to the Green Mountain Care Board request for positions. And then AHS is also in 126. So when we look at our one-time and our priorities tomorrow, I think we should probably include the bills that we passed out that have funding, because that sets a priority when you vote a bill up.
And 218, understanding if they're.
And then we have, 218, which is the,
Shift recovery residences in the one time also.
yeah, so we have that on our agenda today.
Yeah.
So we can, and I'm hoping we can look at it and vote it out.
Today,
Serious, yeah.
I think you have it on.
We'll at least walk through it and vote it out.
Yeah, I think you have it on tomorrow.
We'll vote it out tomorrow.
I think that's what I forget.
Yeah. We don't do things that way. All right. Other questions? So just as a reminder, and Nolan and Emily can help with this, One Care is gone. And we are between payment reform models from in 26. So there's a loss of funding in particular for primary care during that time. So the loss of what is it, $10 million total or something more for in the gap year, called the gap year between
Well, it depends on from what. From one pair, there was the 4 million or whatever.
right. So I'm thinking primary care, but there are gaps in there that are embedded in the budget and trying to cover those gaps so that people don't lose the services that they need before if and when the head model goes forward. So that's important to us. Are we good?
Great.
Thank you. I really appreciate the work that you've done to bring this to us. Very helpful. And so tomorrow I know you're doing more work for us.
Mhm.
I know. We'll see you tomorrow. We'll just take a little break until 10.